we're diving into a topic that's sparking a lot of conversation in the medical community: the incorporation of retail components into outpatient clinics. We'll explore the traditional views that often see retail as tacky, the benefits of adding retail services, and the opportunity costs of not setting them up. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 88, The Retail Remedy: Boost Revenue and Patient Satisfaction. Welcome to the Medical Money Matters podcast, brought to you by Healthy Practices. Today, we're diving into a topic that's sparking a lot of conversation in the medical community: the incorporation of retail components into outpatient clinics. We'll explore the traditional views that often see retail as tacky, the benefits of adding retail services, and the opportunity costs of not setting them up. To begin, let's take a look at the traditional perspective on retail within clinic settings. Historically, many physicians have been wary of incorporating retail elements into their practices. The idea that retail is tacky has deep roots. Traditionally, the medical profession has emphasized a strict focus on patient care, viewing any commercial activity as potentially undermining the sanctity and trust inherent in the physician-patient relationship. This view is rooted in the belief that medicine should remain pure and untainted by commercial interests. Many physicians worry that introducing retail components might detract from their professional image. They fear that commercializing their practice could make it seem like profit is being prioritized over patient care. There's also the concern that retail might undermine patient trust. Patients might question whether recommendations are truly in their best interest or simply a sales pitch. These traditional views can significantly impact clinic operations. By shunning retail, clinics limit their revenue streams and miss out on opportunities to enhance patient convenience and comprehensive care. In a competitive healthcare market, this hesitation can lead to stagnation and an inability to fully meet evolving patient expectations. Let's spend a bit of time considering the benefits of incorporating a retail component into your clinic. While traditional views certainly have their merits, there are substantial advantages to modernizing and integrating retail services. One of the most significant benefits is enhanced patient convenience. By offering necessary products like medical supplies, wellness items, and even over-the-counter medications, clinics can provide a one-stop shop experience. This convenience reduces the need for patients to visit multiple locations for their healthcare needs, saving them time and hassle. I know when I am a patient, I appreciate any time I can take care of everything in one stop. And at that moment, I am not as concerned with price as I am appreciative of the convenience. Retail components can diversify your income sources beyond clinical services. High-margin products, such as specialized health supplements or medical devices, can generate significant revenue. This additional income can help support clinic operations, fund new services, and even offset the cost of uncompensated care. Having retail options available can also improve patient compliance and outcomes. When patients have immediate access to prescribed products and medications, they are more likely to follow through with their treatment plans. Additionally, clinics can provide education on the proper use of these products, further enhancing their effectiveness. Offering a retail component can also strengthen the patient-provider relationship. Patients appreciate the convenience and comprehensive care provided by a clinic that meets all of their needs. This can build trust and loyalty, leading to higher patient satisfaction and retention. Now, If you're not yet convinced, let's talk about how failing to incorporate a retail component into your clinic can have significant opportunity costs. Let's explore what you might be missing out on. One of the most apparent opportunity costs is lost revenue. By not offering retail products, clinics miss out on the potential income from these sales. Comparing the revenue from clinical services to what could be earned from retail products can highlight the financial benefits of adding a retail component. Not having an in-house retail component can inconvenience patients. They might have to make additional trips to pharmacies or medical supply stores, which can be particularly challenging for those with mobility issues or busy schedules, or both. This inconvenience can lead to decreased patient satisfaction and decreased compliance with treatment plans. Clinics without retail components might find themselves at a competitive disadvantage. As more clinics begin to offer comprehensive services, including retail, patients will gravitate toward those that provide the most convenience and value. Keeping up with patient expectations and healthcare trends is crucial to staying competitive in the market. Despite all of these great points, your partners may remain unconvinced. Implementing retail services in a clinic setting can face several barriers and resistance, particularly from those holding traditional views. Let's explore how to overcome these challenges and change perceptions. Education is key to overcoming resistance. Providing data and case studies on successful retail implementations can help illustrate the benefits. Highlight how retail services can improve patient outcomes, increase revenue, and enhance overall clinic operations. Share stories of clinics that have integrated retail seamlessly and the positive impacts they've experienced. The next step is integrating retail services in a way that aligns with your clinic's aesthetic and values. This can be achieved by designing retail spaces that are professional and unobtrusive. Ensure that the retail area complements the clinical environment and maintains a focus on patient care. Training staff to manage retail operations professionally and efficiently is also crucial for seamless integration. This can and should be done in a classy way. Maintaining professionalism is essential to avoid the perception that retail services detract from patient care. Select products that align with your clinic's mission and values. Ensure transparency and ethical practices in retail operations, making it clear that patient well-being remains the top priority. This approach helps build trust and reinforces the clinic's commitment to quality care. To effectively evaluate and implement retail services, it's important to have a structured decision-making framework. This helps ensure that the addition of retail components is well planned and aligned with the clinic goals. Start by assessing the feasibility and fit of retail services within your clinic. Conduct market research to understand patient needs and preferences. This can involve surveys, focus groups, and analyzing patient demographics. Evaluate your clinic's space and resources to determine if you can accommodate a retail area without disrupting clinical operations. Perform a thorough financial analysis to project the initial investment and potential return on investment. Be sure to budget for setup costs, staffing, and inventory and any additional costs you can think of. Compare these costs to the potential revenue from retail sales to ensure the investment is financially viable. Consider the long-term financial health of your clinic and how retail services can contribute to sustainability. Operational planning is also crucial for a smooth implementation. Set up supply chains and establish vendor relationships to ensure a steady flow of products. Implement inventory management systems to keep track of stock levels and reduce waste. We highly recommend utilizing an inventory management software system so that this is not done manually. In many cases, you'll have thousands of dollars worth of inventory, and tracking it can become overwhelming for staff. We've seen many practices where the physicians just assume the team can handle it themselves, and they wind up losing money or not meeting their retail potential as items are out of stock or ordering is behind. Train staff to handle retail operations efficiently, focusing on customer service and product knowledge. And, as we said above, be sure to provide a script for when your patients will invariably say, "I can get this cheaper on Amazon." In those cases where they clearly value price over convenience, it's fine to let them. Marketing and patient education are essential to the success of your retail services. Promote the new retail component to your patients through various channels, such as newsletters, social media, and in-clinic signage. Educate patients on the benefits and availability of in-house products. Highlight how these products can enhance their treatment plans and overall health. Once retail services are implemented, continuously monitor their performance. Collect feedback from patients and staff to identify areas for improvement. Analyze sales data to determine which products are most popular and adjust inventory accordingly. Be flexible and willing to make changes based on patient needs and market trends. To recap, we've discussed overcoming barriers and changing perceptions about retail in clinics, as well as developing a structured decision-making framework for implementing retail services. By educating physicians and staff, integrating retail seamlessly, and maintaining professionalism, you can successfully add retail components to your clinic in a classy way. A thorough feasibility assessment, financial analysis, operational planning, and ongoing monitoring are keys to ensuring the success of your retail services. Thank you for joining us on the Medical Money Matters podcast. If you found this episode valuable, please subscribe, share it with your colleagues, and leave us a review. Your feedback helps us improve and reach more listeners like you. Follow us on social media, visit our website, and stay tuned for more episodes. As always, feel free to reach out to Healthy Practices for expert consulting services. In our next episode, we'll explore tech add-ons that will make your EHR hum. You can find more information online at medicalmoneymatterspodcast.com, and you can sign up to be notified when enrollment opens for the Medical Money Matters e-learning program for a mini MBA physician style, which will carry CME credits and will be released in upcoming months. In that, we'll do an even deeper dive so you can understand dynamic budgeting strategies, cash flow forecasting, and other more esoteric financial concepts. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you and send you my heartfelt gratitude for all that you do for your patients all day, every day.